The biggest thing with infectious diseases in general is that we can be what's called a carrier, which is someone who is infected with an organism but doesn't actually have symptoms. And we can be carriers for most of the illnesses that you think of. We can have like that health bias almost, where we're healthy, so we think that it's fine to be around people that are sick because even if we get sick, we'll be okay. Do you have a fever? Do you have a sore throat? Have you been exposed to someone who's sick in the last 10 days? Like, those are my 3 non-negotiables, because if you have a fever or a sore throat, you're contagious. We know it. When it comes to respiratory illnesses, my personal feeling is I want as much protection as I can have. If I get sick and I go out into the public, I could be exposing somebody whose immune system is compromised, and that's not fair to do that to somebody.
Hey everybody, welcome back into another episode of the Dental Assistant Nation podcast. My name is Kevin Henry, the founder of Dental Assistant Nation. I'm so glad you've joined us. We're going to touch on a very timely topic today. I'm really excited to get into it with an expert out there, and that is Joyce Weeks. Joyce, how are you?
Doing great. How are you, Kevin?
I am great. So glad to have you on and looking forward to our conversation today. But before we dive into that, tell our audience a little bit about you.
Yeah, great. So my name is Joyce, obviously. My company is Dental Ed. So I have been teaching about OSHA and regulatory compliance here in California for the last almost 11 years. It'll be 11 years next month. So my background is in infectious disease. I have a degree in biology and then a master's in immunology and global health. And I fell into dentistry, as so many of us do. My dad was a dentist here in San Diego, where I'm from. And my mom actually started this company 37 years ago.
Okay.
When all the regulations started changing. She was a nurse working at one of the hospitals teaching cardiac patients at the time. And my dad was like, we don't know what we're supposed to do. There's so many different agencies now that are trying to tell us like different things. It's really confusing. We pretty much just have to hire an entirely other person to tell us how we're supposed to manage all of these different regulations. You need to start a company and help people figure out what to do. So that's what happened. And then I started working with her because I really wanted to teach about bloodborne pathogens. I moved back to San Diego to do my thesis research at the Scripps Research Institute. I was working on HIV vaccine research and loved infectious disease and bloodborne pathogens. And yeah, I know. And so I started following her around and quickly found out that not everyone else thinks this stuff is as fascinating as I do.
You know, we've each got those things that call to us, and I'm thankful that does to you, because that's going to lead us into today. And we're doing this at a great time. A lot of kids are going back to school. We've got a lot of community all of a sudden getting back together. And we know with that, sometimes those bugs crawl out of there as well.
So. They certainly do. Yes. Yeah.
So is this a time that dental assistants and dental team members and dentists even need to be more vigilant than ever about staying well?
Absolutely. So I was actually just in the office last week and got a question like, we have an outbreak right now as an orthodontic office. Hand, foot, and mouth. What are we supposed to do?
Wow.
And that was when I was like, I've actually had that. My oldest, I have 2 boys, and my oldest, I got it from him when he was about 6 years old. It is not the same to get it when you're an adult than it is if you're a kid. My son was like, la, la, la. I was bedridden for like a week. So very different when you get it as an adult. But yeah, and they were like, how do you get it? We don't know anything about it. We just know, obviously you're looking inside the mouth and there's lesions in the mouth as well as around the lips and on the outside of the mouth that you can see for that particular illness. So that was one of the things that kind of brought this to my attention. So I knew when we were going to be talking that it was like, this could be a good thing for us to discuss.
And is that something that simply the child brought it back from school or from friends? I mean, is that what we've got to really be thinking about this time of year?
Absolutely. So the biggest thing with infectious diseases in general is that we can be what's called a carrier, which is someone who is infected with an organism but doesn't actually have symptoms. And we can be carriers for most of the illnesses that you think of. When I give my lectures, I teach a lot in private offices, but I also teach, as a speaker as well. And anytime that I'm talking, I always like to go over the ideas of what these different diseases are and how they're transmitted, so we understand not just what we have to do, but why. Because I feel like if we understand why we have to do something, we're much more likely to actually do it. We've all been teenagers. Nobody does something just because someone's telling us we have to, right? I have a teenager right now. it doesn't work very well to just be like, you have to do this. Um, so that's kind of the main thing that I focus on in class. And so when it comes to infectious disease, understanding how these organisms are transmitted. So when it comes to like hand, foot, and mouth, in that class, I was like, I don't actually know completely off the top of my head. I think it's a respiratory illness, but it could be contact. Let's look it up. So we went online together in the middle of the class and searched it and figured out that it's contact transmission. It's a respiratory virus. So it's an aerosol transmissible disease. So you can get it from touching surfaces. And so in real time, we created a plan for that office on how to handle that current outbreak and what they could do to deal with the fact that they probably will have kids coming in that they may identify what the lesions are. And we even looked up what pictures looked like.
And just being able to identify that, does it make us more aware? I feel like that after COVID, after it kind of backed away a little bit, a lot of us took down those guards. And not that I want to put any fear factor or anything else in there at all, but do we need to have those guards up for those other diseases that come through there that are airborne?
I truly do believe we do. And I think that unfortunately, the measles outbreak that we're experiencing right now in the United States is a big indicator of that. And, it's one of those things that wherever you fall on the spectrum of vaccination is kind of irrelevant. It's still a matter of looking at what things we can do as a community to protect ourselves, our patients, our families, our friends, looking at this from the perspective of being proactive instead of fear mongering, right? So that's the approach that I take, is what kinds of things can we do to keep ourselves safe and keep our community safe? And it's not about, an us versus them mentality. It's really about us rallying together to work together as a team. And that's, I think, a lot about the team, within the office, within our community, all of those different things.
So let's say I'm a dental assistant. I've got a second grader, has gone back to school. That second grader comes home. What do I need to do to make sure that second grader, whatever he or she came into contact with, doesn't go with me to work?
So, the first line of defense, honestly, if you're somebody who's willing to get vaccinated, is definitely to look into what vaccines are recommended and being up to date on those. If you choose not to vaccinate, obviously that's your choice. And when I give lectures, I talk about, what the purposes are of vaccines, how those work, all that kind of preventative stuff. But so that's the first line. The next thing that we talk about, it's hand washing. The first thing that I do with my kids when they get home from school, I have them wash their hands. Mm-hmm. And honestly, we started that throughout COVID, the virus that nobody wants to talk about. Mm-hmm. We always joke it's the one that shall not be named. Because for me, I'm just trying to reduce the number of organisms so that it's easier to manage. And whether it's a respiratory illness, fecal oral transmission, so you touch something and then touch your mouth and you get it that out, like enterovirus or one of the lovely ones that make you sick, throw up. There's all kinds of stuff that we can get. And it's not necessarily going to completely stop you from getting sick, but it can help our immune systems be able to manage it. So those are some of the things. And then, that would be like the first thing that I do. Some families even have their kids shower when they first get home. I don't, because that's a lot of extra work for me.
Yeah.
But, if you can, that's great. Those kinds of things. You're just trying to reduce the numbers of viruses, bacteria, pathogens, organisms, whatever you want to call it, the bad guys.
And what do we need to remember this time of year, particularly about our masks and mask usage?
Yeah, so there are different kinds of masks and respiratory devices. And so having an understanding of what the different kinds are, I personally recommend that offices always wear at least a level 3, because you're doing things where, you're aerosolizing constantly in dental offices. And so that does give you the highest level of protection. Ideally, depending on the tasks that you're performing, you may even want to consider wearing a respirator like an N95. I know that those are very cumbersome and uncomfortable and people don't want to wear them. So to be realistic, I encourage offices to just not even bother buying a level 1 or 2 and just have 3s, because that's realistically what's going to give you the most protection. But when it comes to what you're supposed to wear based on the dental procedures and things like that, there's different ideas about, you can use a level 1 for exams and those kinds of things. But when it comes to respiratory illnesses, my personal feeling is I want as much protection as I can have.
Sure.
So I also think simplicity's sake, you can order one type and not have to worry about, well, is this the right level for the right procedure? you have so many other things to deal with. Let's just take that off the plate and just have one mask, one glove, keep it simple as much as possible.
And it's about using, the mask the right way as well. I mean, as silly as that sounds, I think,
so true.
but I think it's a good time to really remind ourselves that if we're going to take all this effort to protect ourselves, let's use it the right way as well.
That is incredibly true. I can't tell you how often I go into offices and see the mask on backwards.
That's a problem.
Yeah, doesn't work. Or down around, over the mouth, but not the nose, which we've seen all the time. So, and that fits into how OSHA requires that you're supposed to do training on an ongoing basis as a team. So whether it's, depending on the size of your team, it can be quarterly if you have less than 10 employees, or it's monthly if you have 10 or more employees. So you can do that as one of your team trainings, is let's remind ourselves how we're supposed to put on or don or, doff or take off our protective attire. And OSHA has videos on it. You don't have to hire someone like me to create these. You can, but you don't have to. You can just go online and find it on Google, go to YouTube. There's all kinds of options for that stuff.
And the silly thing is, I can imagine some of our viewers and our listeners right now are rolling their eyes. And they're going, really? We're talking about how to properly put on masks? But I will tell you, I've been in dental practice and I've seen the same thing that you have. And I just kind of shake my head, because it's not only expense for the practice to have those masks, but also, let's be honest, it's a little bit of a pain for you to wear them every day too. Oh. So why not do it the right way if you're going to have to go through it all anyway?
Yeah. I mean, I actually get chuckles every time I have a slide coming up. Every single class, how to wash your hands every day. And I'm like, I know this seems ridiculous, but I cannot tell you how many people I see do it the wrong way. I'm not the a super annoying person that says you're washing your hands wrong. You have to do it this way when we're in a public restroom or something. I don't do that. Okay. I might think it, but I don't say it out loud. I do have a filter. But I have moments of even with my kids and things like that, I'm if you get your hands wet first, and then you get soap, you're going to make more bubbles, which gets your hands cleaner. So I might go through that every day because I know that it is helpful. But yeah, it's just one of those things that, again, the why. It's not just me telling people you have to do this, but taking that extra couple of minutes to go through, this is the reason why we do it this way, then I can see things shift for people. And it helps, if you care, you're more likely to do it versus someone just telling you have to.
So I'm going to throw a scenario at you. And you didn't know I was going to do this before, but I've actually had a dental assistant ask me this question, so I want your take on it. Dental assistant walks in, gets the patient, brings him back to the operatory, and tell immediately that patient isn't well.
Yeah.
And knows that this is a sick patient who's in the operatory, but the doctor doesn't want to cancel, doesn't want that hole in the schedule. How do we get through a sick patient appointment and not get ourselves sick?
So that is a situation where I would absolutely throw on an N95 as an employee. There's some issues there OSHA-wise with treating a patient that's sick, especially here in California. You can't. It's actually not allowed. We have the aerosol transmissible diseases standard, which means you can't, if you're treating patients that have an aerosol transmissible disease, there's a whole other way that they have to be treated.
Okay, so then let me twist it. Should the dental assistant say something if we've gotten to that point? I mean, how do you already, if the dam's been broken, how do you make sure the water's put back in?
Yeah, so at that point, I would say it depends on the state where you're located. If it's a California state, then you have to follow aerosol transmissible diseases standard from OSHA. So then at that point, you're shifting from the regulations. And so the regulations here would be, we have to screen all of our patients prior to treatment. So the second that they walk into the office, they actually have to be screened for aerosol transmissible diseases. And if they are deemed to be sick, they can't be seen.
Okay.
Yeah. In other states, they don't have the same regulations.
Yeah.
For federal OSHA, obviously.
I know this wasn't California, just FYI.
I know. Yeah, no, exactly. So in other states, there is still going to be that same situation. So you could make a case that it's not safe to treat a patient. When you work in a dental office, you are assuming that you're treating healthy patients. Now, we did talk about carriers earlier, which means that, in theory, patients could be coming in sick. And we're not talking about bloodborne pathogens, by the way. Standard precautions are there to protect you from bloodborne pathogens. So that's a whole other situation. So I'm talking about aerosol transmissible diseases where somebody's coughing or sneezing and can get you sick. The other thing that I would be concerned about in that scenario, though, is also other patients that are being treated.
True.
Because you can't protect the next patient that's going to be coming into that operatory from getting sick because they can't wear a mask to be treated, right?
Great point. Yep.
So that's one of the things that we teach in our offices is even if you had great protocols, you had a separate ventilation system, all those different things, the next patient is still potentially going to get exposed to whatever it is. And if it's something like measles, where that virus can live in the air for 2 hours, there's not a safe way to treat a patient that's sick. But there's a difference between ideally and reality, right? We're going to have situations where this happens. So going back to what you're saying, if a patient comes in and they're sick and the doctor's like, we have to treat that patient, for that person in that moment, I would say wear an N95. I would do the best to not use that room, run a HEPA filter the entire time that that patient's being treated. If it's a respiratory illness, how's the patient going to breathe? Are they congested?
Right.
There's just a lot to it, but that would be like and wear eye protection, of course. And then I would try to not use that room for a good few hours if possible. But of course, you're not going to be able to if you have a full schedule. I mean,
and that's the thing in this scenario, and this is a real scenario, is that you're absolutely right. The doctor wanted to make sure that schedule was full, production was at 100%, all that stuff going in, and this team member really felt like it put her at risk whenever then she went home. And there was a big problem with that in her mind.
And it is in mine too, because my biggest concern is what if she has a premature baby at home?
Sure.
What if she has a parent or a family member that's a cancer patient?
Yeah.
Is immunocompromised or has, a family member that has heart failure. The thing that I have a hard time with is we can have like that health bias almost where we're healthy. So we think that it's fine to be around people that are sick because even if we get sick, we'll be okay. We don't think about the impact of the fact that if I get sick and I go out into the public, I could be exposing somebody whose immune system is compromised. And for them, the disease that just makes me a little annoyed could be deadly. And that's not fair to do that to somebody.
It's not. And I think what you just said right there really wraps up why we've got to be so vigilant right now, because you never know that other person's whole story, whether that's a patient who's in there, another team member, whatever it might be. So great point.
Exactly. And you're treating patients that are immunocompromised.
Absolutely.
Yeah. And it may or may not be on their medical record. It should be, but are there any updates? And they're like, no.
No changes.
I don't know.
Exactly.
They never know how to update and that's why we have to ask really pointed questions. So coming back to, how we manage stuff here in California, it used to be like asking that whole litany of COVID-19 questions. I'm like, do you have a fever? Do you have a sore throat? Do you have a running? And I'm like, let's just make this simple. Do you have a fever? Do you have a sore throat? Have you been exposed to someone who's sick in the last 10 days? Those are my 3 non-negotiables, because if you have a fever or a sore throat, you're contagious. We know it. I don't care what you have. I don't care if it's the flu, if it's COVID, if it's measles, I don't need to know what it is. I don't particularly want it. And so you can keep it to yourself. And it's also better for the patient too, to delay treatment because they're immunocompromised also during that time when they're fighting off that illness.
Absolutely not the gift that keeps on giving. There's no.
Yeah, we don't want that gift. Please keep it to yourself. Thank you. We'll see you in 10 days.
There you go. Well, Joyce, hey, I know we could talk about this for hours on end, but I want to be cognizant of our listeners' time as well as yours. So how's a good way if a dental assistant has questions, if he or she wants to learn more, or maybe has some of those tough questions like I just asked you, what's a good way to reach you and learn more?
Yeah, so my website is dentaledinc.com. So it's DENTALEDINC.com. And all my contact information is there. My email, phone number, everything. So you can get a hold of me on that website.
Right.
Yeah.
And we're going to have that in the show notes. So very easy for you to find. And Joyce, as always, I really appreciate it. And thanks for that reminder as we get to this time of year about that we've got to be more vigilant than ever.
Thank you so much for having me here.
Absolutely. And dental assistants, we want to keep you safe. We want to make sure that you're keeping your family members safe. We want to make sure that you have the best day possible. And that includes your health as well. So appreciate Joyce being on today and appreciate you listening to this episode of the Dental System Nation podcast. Till next time, it is Kevin Henry, founder of Dental System Nation, reminding you, you are awesome, and we'll see you next time. And as always, I'm wishing you nothing but success ahead.